Hi, this is Dr. Buvaneswari from Chennai, GBR Fertility Centre and Hospital. Today I am going to talk about retroverted uterus and pregnancy problems. Generally, people have a retroverted uterus in 20 to 25% of the cases. Otherwise, the uterus is either upward towards your umbilicus, that is navel, or it is towards the backside spine. So, both sides it can be there. It is a inherited condition. By birth, the uterus decides to be either up or down or anteverted, that is called forward or backwards. So, directed like that. But generally, 80% of the time they will have a normal anteverted uterus. That is called the uterus is facing anterior, that is front of your abdomen. Sometimes 20% of the time only it is facing backwards. Most of the people may not be knowing this position of the uterus. Generally, they conceive and deliver. That is why we don't know. But in infertility, when they come, we always do a fertility scans and pelvic scans. When we do the scan, we try to mention that it is retroverted or it is anteverted, anteriorly placed or front placed, or it is directed backwards. That time only they will have a doubt whether it is a problem or not. It is not like that. People can conceive in that uterus and deliver. Only certain conditions like when they have associated pelvic infection or endometriosis, sometimes fibroids, these conditions again cause the uterus turning backwards. Only those conditions are dangerous. That is why we are saying that retroverted uterus is the indication of few things. One is by birth it can be directed backward, or because of these conditions it can be pulled backwards. When it is pulled backwards, then it has got its own problems. That is why the condition as such, we have to rule out whether it is pulled by some additions, that is called a string of fibers. It will be pulling the uterus backwards. You will have severe pain, and also you will not be able to have a natural pregnancy. The infertility is very common with this association. Only because of the reason is generally when it is turned backward, the cervix and uterus angle is getting affected. Sperm entry also is getting difficult. That is the reason we are finding it. Also again the fibroid, which is also impairing the blood supply. Sometimes endometriosis affect the quality of the egg, and pelvic infection affect the tube. These conditions again pulling the uterus backward, not only pulling the uterus, it also affects the tubes, ovaries, eggs, everything. That is why they have a more infertility reasons. And earlier if you see, you can prevent it. Only treatment for these conditions are doing a laparoscopy. Make sure that remove the fibroid if it is the cause. Endometriosis has to be corrected and give the medical management. And if it is a pelvic infection, the damage has to be removed. It is a chronic damage, then we have to remove the certain tubes and things, and then go for a treatment as early as possible. These are the better suggestions for these conditions. So don't worry about being just a retroverted uterus. Doesn't affect fertility or cause any problems. But only when it is associated with the conditions like what I have said, then you have to go to the doctor and make sure that those conditions are all treated, and you can go for a pregnancy. All three conditions what I have mentioned, like a fibroid, pelvic infection, endometriosis, these three conditions can recur and cause problems later. That is why as once you remove the problem, go for a better treatment or ART and complete your pregnancy. That is my sincere advice. Thank you so much.